Hello there, my name is Dr. Charles Moser. I'm the founder of the Dental Science Alliance, which is the only coaching consulting platform that any dentist team will ever need. I'm out for a walk today, and that can only mean one thing. It's time for Chat with Chuck. Now, if you like these Chat with Chucks, please share them with a friend that you think might enjoy them. Go to our YouTube page. Just go to YouTube and then search Dental Science Alliance, and you'll find all these Chat with Chucks and some of our expert webinars and some of our coaches who have done some amazing videos as well. Now, last time we started talking about the difference between strategy and execution. And strategy is actually pretty easy. That's all the stuff that you put on the whiteboard during the meeting. That's all those things that end up being collected into buckets and distributed out to certain people that are going to be accountable for these things. But the actual execution of these strategies is really difficult. And why? Well, the reason is because you get sucked up into the whirlwind of what we call doing business, and all of these amazing strategies sit in these buckets and they don't get executed because you're trying to run a business, or you're trying to run your team, or you're trying to make a profit. And so we have to come up with an execution strategy that is, well, just as important as any other strategy that you're going to design. Now, the execution strategy falls into 4 categories, if you will, and I'm going to talk about 2 of them today, and then on my next walk, I'll talk about the other 2. So, the first one is focused on the wildly important goal. Now, hang on. The goal that I'm referring to is not an organizational goal, okay? It has to be a team goal. It's your admin team goal. It's your hygiene team goal. It's your clinical team goal, okay? So the goal of the organization might be to increase EBITDA, but that's not a good goal for you as an admin team, frankly. And by the way, the problem with that focus on EBITDA or even collections, I'll go into this in strategy number 2, is those are lag indicators. So as a team, as a department, not as an organization, you need to identify what your wildly important goal is. Strategy number 2 is to make sure that you're working on lead indicators and not lag indicators. So like I said, production is not a lead indicator. Collections is not a lead indicator. What you have to focus on is what are the things that are going to act as a lever to move that big rock, which is collections, right? Okay, maybe it's, hey, we're going to focus on not letting the patient leave without paying for their co-payment or their patient portion of the treatment, right? Hygiene goals, right? So the lag indicator is hygiene production, right? But the lead indicator could be something like making sure that all of your hygiene patients have a reappointment date already set in the calendar before they leave from their previous appointment, right? So make sure you're working on an indicator that is going to affect the lag measure. You want to work on lead measures, and these are, you want to focus on the levers, right, that are going to move the rock. We all know that if you put a board underneath a rock, you apply a little force to it, chances are you get that thing to move. So, now look, none of this is really brain surgery. None of the stuff I talk about ever really is, but are you doing it, right? Are you executing on the execution strategy that I'm talking about here? Step number 1, make sure you're working on the wildly important goal for your department or for your individual team. Number 2, create strategies on lead measures, not lag measures. Hey, I hope this helps. I think we'll do an execution type of mastermind. I'd really love to get some people together, study this execution strategy, and maybe implement it and see what happens. I hope these are helpful. Talk to you soon.